Hello viewers, this is Dr. Rajiv. Welcome to your education channel YouTube Surgery and Orthopedics Education. Please consider subscribing to it and sharing it with your nears and dears to help them prepare not only for the MBBS course but also for other postgraduate and medical job entrance examinations. In this lecture, we will discuss 10 MCQs on a very important and exam productive topic, liver. Common pediatric liver tumors are hepatoblastoma, hepatocellular carcinoma, and infantile hemangioendothelioma. Hepatoblastoma is the most common liver tumor of early childhood. This rare cancer typically affects children under the age of 3 years. It usually occurs in male children and mostly involves the right lobe of the liver. Activation of the WNT beta-catenin signaling pathway is a characteristic feature of hepatoblastoma. There is increased expression of WNT target genes such as glutamine synthetase in nearly all cases. Hepatoblastoma is associated with familial adenomatous polyposis, Beckwith-Wiedemann syndrome, and Aicardi syndromes. Children with these syndromes may have a higher risk of development of hepatoblastoma. Polycystic liver disease is a rare inherited condition characterized by the growth of multiple cysts in the liver. It is commonly seen in association with autosomal dominant polycystic kidney disease. Ultrasound, CT scan, or MRI can be used to detect the presence of liver cysts. It is mostly asymptomatic. Rarely, symptoms may occur due to the mechanical effects of liver enlargement, such as bloating, abdominal pain, feeling of fullness, and shortness of breath. Many people with PLD do not require treatment. In cases of troublesome symptoms, cysts may be surgically removed or drained to alleviate mechanical effects of liver enlargement. Liver transplantation may be indicated for patients with rare complications such as infection, bile duct obstruction, jaundice, intestinal obstruction, bleeding, or liver failure. Hemangioma is the most common liver tumor. These are often multiple. The lesion is usually apparent on ultrasound. In sonographically uncertain cases, contrast CT scanning shows the characteristic appearance of slow contrast enhancement due to a small vessel uptake in the lesion. Diagnosis is usually incidental. Usually, no treatment is required. Surgical excision is only recommended if the patient is significantly symptomatic. Hepatic adenomas are benign liver tumors found almost exclusively in females aged between 25 and 50 years. These are classically associated with high dose estrogen oral contraceptive use and are generally solitary. Hepatoma, also called hepatocellular carcinoma, is the most common type of primary liver cancer. The treatment of alcoholic ascites includes a combination of lifestyle changes, medications, and sometimes procedures to manage the symptoms and underlying liver disease. The most crucial first step is to stop drinking alcohol completely to prevent further liver damage. Next, recommend a low sodium diet to reduce fluid retention. This includes avoiding processed foods, salty snacks, and reducing salt intake in cooked food. In some cases, fluid intake may need to be restricted to help manage ascites. If the above measures fail, the patient continues taking alcohol and the disease progresses. Treatment options include diuretics, paracentesis, and transjugular intrahepatic portosystemic shunt. Liver transplantation plays a crucial role in the treatment of advanced alcoholic liver disease. For patients with end-stage liver disease due to alcoholic liver disease, liver transplantation can be a life-saving procedure. The Milan criteria were developed about 25 years ago. It is still considered the benchmark to determine eligibility for liver transplantation in patients with cirrhosis and hepatocellular carcinoma. Outcomes of liver transplantation is considered excellent for patients with HCC and cirrhosis who meet Milan criteria. That is, in the explant either one tumor of less than 5 cm or 2 to 3 tumors of less than 3 cm in size. However, despite meeting Milan criteria, most HCC recurrence occurs within the first 2 years post-transplant, and it is recommended to screen patients appropriately for early recurrence detection. To estimate the recurrence risk, the risk estimation of tumor recurrence after transplant or retreat criteria was developed. This well-validated tool estimates the risk of HCC recurrence based on the size of the largest tumor, the number of viable tumors, microvascular invasion, and serum alpha-fetoprotein at the time of transplant. The retreat score ranges from 0 or low risk to 5 or more or high risk. The given patient falls in the low to intermediate risk range. The surveillance strategy may vary slightly center to center, but alpha-fetoprotein plus imaging with CT or MRI every 6 months for 2 years and annually thereafter is appropriate for patients with a retreat score of 2. An ultrasound as in choice B is not appropriate for post-transplant HCC surveillance. Adjuvant systemic therapy as in choice C is not recommended for any patient undergoing liver transplant for HCC. On the other hand, calcineurin inhibitors have been associated with increased HCC recurrence, hence choice A may be excluded. Hepatorenal syndrome is a form of acute kidney injury that characteristically occurs in liver cirrhosis. It occurs due to reduced renal perfusion and overactivity of endogenous vasoactive systems. The treatment of hepatorenal syndrome in patients with alcohol-related cirrhosis involves several approaches aimed at managing both the liver and the kidney dysfunction. Apart from general measures such as abstinence from alcohol, volume replacement, and correcting electrolyte imbalances, intravenous albumin infusions in combination with terlipressin 1 to 2 mg every 4 to 6 hours improves short-term survival. Diuretics and beta blockers, as well as nephrotoxic drugs, including vasodilators and non-steroidal anti-inflammatory drugs, should be stopped. The Child-Pugh scoring system, also known as the Child-Pugh-Turcotte score, is a clinical tool used to assess the prognosis of chronic liver disease, particularly cirrhosis. The Child-Pugh score is a predictor of postoperative mortality after photoconvulsion surgery and predicts mortality risk associated with other major operations. The score is based on 5 clinical measures: bilirubin, albumin, prothrombin time or INR, ascites, and hepatic encephalopathy. MELD score is used to assess prognosis in chronic liver disease. It is a complex algorithm including serum creatinine, serum bilirubin, and INR. Child-Pugh score is commonly used to assess the overall severity of liver disease and surgical risk, whereas MELD is primarily used to prioritize patients for liver transplantation and predict short-term mortality. The Pediatric End-Stage Liver Disease Score or PELD score is a tool used to assess the severity of liver disease in pediatric patients to prioritize them for liver transplantation. It is like the MELD score but has been adapted to include the unique aspects of pediatric liver disease. The Sequential Organ Failure Assessment or SOFA score is used to monitor a patient's status in the intensive care unit and predict their chances of survival. The soluble liver antigen is often found in patients with autoimmune hepatitis. It is virtually absent in non-hepatic autoimmune disorders. Anti-SLA has been described typically in adult patients, often with aggressive disease. The anti-soluble liver antigen test is used to detect antibodies against soluble liver antigen, often found in patients with autoimmune hepatitis. The target of anti-SLA has been identified as a serine transfer RNA associated protein complex. Hydatid disease is a zoonosis caused by the dog tapeworm Echinococcus granulosus. The clinical course of a hydatid cyst is largely asymptomatic until complications occur. CT scan is the best imaging technique to identify the lesion. Diagnosis is suggested by finding a multiloculated cyst on ultrasound and is confirmed by the finding of a floating membrane within the cysts on CT scan. The surgical treatment options range from deroofing with evacuation of the contents to local excision of the cysts and liver resection. The focal nodular hyperplasia is a benign liver condition. It is the second most common benign liver tumor after hemangioma. In this, there is a focal overgrowth of functioning liver tissue supported by fibrous stroma. FNH is characterized by a central fibrous stellate scar with radiating septa. The central scar is seen in about 75 to 85% of cases. Microscopically, there are cords of hepatocytes divided by multiple fibrous septa originating from a central scar. Contrast CT or MRI may show the central scar and a hypervascular lesion. The lesion contains both hepatocytes and Kupffer cells. MRI using liver-specific contrast agents such as gadoxetic acid or superparamagnetic iron oxide, which is taken up by Kupffer cells, may be useful in differentiation of FNH from a metastatic lesion. There is no malignant potential in FNH. Thank you so much for watching. Please subscribe and stay tuned for more educational videos.